Hello, I'm John Sweetenham, the Associate Director for Clinical Affairs at UT Southwestern's Harold C. Simmons Comprehensive Cancer Center and host of the ASCO Daily News Podcast. On February 24th, Russia launched an unprovoked attack on Ukraine, which has led to international condemnation and sanctions against the Russian government. ASCO has joined its Ukrainian members, the worldwide oncology community, and healthcare providers in condemning Russia's invasion of Ukraine and has called for an immediate cessation of the hostilities and full protection and safety for all Ukrainian patients, healthcare workers, and medical facilities. Today, we'll be discussing the impact of the war on patients with cancer and how oncologists are coping under these extremely difficult circumstances. Joining me for this discussion is Dr. Mariia Kukushkina, a senior research associate in the Department of Skin and Soft Tissue Tumors at the National Cancer Institute of Ukraine in Kyiv. My guest and I have no conflicts relating to our topic today. Our full disclosures are available in the show notes, and disclosures of all guests on the podcast can be found in our transcripts at asco.org/podcasts. Dr. Kukushkina, we are so glad to speak with you today. I understand that you're speaking with us from your home in Kyiv. Is that right?
Yes, you're absolutely right. Thank you very much for this invitation and for this opportunity to share the information about situation in Ukraine now.
Well, we really appreciate your taking the time to speak with us. Could you begin by describing the current situation which is facing oncologists and patients under your circumstances at the moment?
Okay. First of all, I would like to thank for incredible support to Ukraine and Ukrainians all over the world. It helped us to be strong, and I am very appreciating ASCO Daily News for this opportunity to discuss the situation with cancer care in Ukraine. So what do we have nowadays? Unfortunately, only some cancer centers in our country are working now. Some cancer centers have been destroyed. Others are in areas of active hostilities. In majority cases, active cancer centers can provide only outpatient systemic treatments and urgent surgery. Another problem that some staff unable to get to work due to lack of public transport, as you understand. On the other hand, cancer centers on the west of Ukraine are overloaded by patients that coming from other regions. And a lot of our patients came abroad because some countries, Poland, Romania, Hungary, Slovenia, Baltics, declared that Ukrainian refugees are entitled to the same medical services as Polish or Romanian, etc., insured people without payment of social health insurance. And on behalf of Ukrainian people, I would like to thank all countries that accept our patients and help them as such as they can. But some patients cannot leave their cities, as you understand, and families, and so they still stay in Ukraine. And almost all staff, except those who are mobilized into army, have decided to stay to take care of our patients. Because people with countries are hit double, war and cancer. And almost all Ukrainian oncologists provide free online consultations and try to help with healthcare organization globally. Our oncologists, nurses, ambulances, volunteers, radiologists, surgeons, and everyone else in healthcare do everything in their power to ensure that patients can continue treatment. And I really admire these people.
Yes, this is really absolutely remarkable under these really extraordinary circumstances. We've seen some news reports about pediatric patients with cancer who've been receiving their treatment in the basements of hospitals because obviously that was regarded as being the safest location for them. Can you comment a little on what is happening with inpatient cancer care in Ukraine at the moment, and perhaps also comment on whether you feel that the healthcare workers who are providing this essential care are placing themselves in the way of danger in those hospitals?
No doubt that health workers and patients are in extra danger in hospitals nowadays because they are forced to be treated in conditions of hostilities. First of all, it's difficult to get to cancer centers. For example, I live on the one bank of the Dnipro River, but National Cancer Institute, where I'm working, is on the another bank. And we now have the problems with public transport. So it's very difficult to get to the work. And I prefer to do something like online consultation, to do something organization work, etc. And of course, all patients and our staff must go down to the shelter or basement during each air raid. And sometimes it could be up to 10 times per day. Some cancer centers, the systemic treatment could be provided only in these basements. So these videos that you mentioned, it's true, absolutely. And of course, all our patients and doctors don't know if the building will be intact when they come back from the shelters.
Of course, yes. You mentioned online consultations and telehealth. And has that been adopted widely in Ukraine during the war so far? And also, could you comment on whether the COVID pandemic had helped you to enhance your telehealth capabilities in the country?
I want to emphasize that nowadays we consult patients absolutely free. It's something like volunteer work for us. So a lot of our doctors and me too post in Facebook their own phone numbers. It's our private phone numbers because we understand that patients need help. Sometimes they need only something like we need to calm them. And it's very important too. But sometimes we can do something very practical for them, even in to be a distance from them.
Thanks. You mentioned earlier that many of your patients are now taking opportunities to be treated in other countries, such as Poland and Romania. Can you describe how you're able to find care for these patients in these other countries and whether the patients are needing help to leave the country?
In my opinion, nowadays we have two different problems. One of them, the age to cancer patients that stay in Ukraine, and the other one is assistance for Ukrainian refugees. And as I know from media that nearly 1 million people nowadays left Ukraine, 1 million people.
Yes.
And a lot of them are cancer patients and they need treatment. And now we need assistance for these refugees, safe passage for cancer patients and people in similar situation out of the country to support structures in the receiving countries. And I want to thank again to my colleagues in different countries. And first of all, I want to thank my colleagues from Poland and Romania, because on the first days of the war, they helped us. They made something like list of cancer centers with contacts in which our patients can get. So it wasn't only let's go to Poland or let's go to Romania and you will receive the treatment. It was absolutely concrete, specific cancer centers. And I want to say thank you again for my colleagues from all countries that support us. I'm sorry, I'm sure that maybe I forgot someone now, but it wasn't intentional. We are currently in under the big pressure, so as I understand.
You mentioned that you need assistance, and I wonder what kind of assistance and what kind of supplies do you think is most useful to the oncology community and to other healthcare facilities right now? What are you most in need of in terms of assistance and supplies?
I think that we need something like list of cancer center for every specific type of cancer with contacts. It will be very useful for our patient. And of course, we need the help with safe passage for our patient. Nowadays, it's very difficult to get to the West Ukraine and to cross a border. And of course, it's difficult to healthy people, and it's much more difficult for patients with cancer. And it's very important that sometimes now our patients don't have medical documentation with them. Some of them don't have access to this medical documentation because their house is destroyed. And it's difficult to get this documentation, for example, from cancer centers in Ukraine, because it's impossible to get to work, or buildings may be destroyed too.
Yeah, so if I understand you correctly, the urgent needs are, number one, making sure that the patients are able to get to ongoing care, if not in Ukraine, then in one of the neighboring countries. And then number two, ensuring their safe passage so that they can get to that country and receive their care.
Yes. And I want to say that one of the biggest problems, in my opinion, is the palliative care in our country nowadays, because a lot of patients don't have opportunity, not only go abroad, they don't have opportunity go out home. And it's we have a lot of difficulties with palliative care now. And honestly said, I don't know how to solve this problem when, for example, Kyiv is bombing every couple hours.
What can organizations like ASCO do at the moment to help Ukraine's oncology community?
No, the support of ASCO is very important for Ukraine's oncology community, because our main task, even during the war, is the treatment of cancer patients. Nowadays, we have a lot of tasks in our country. I want to say that a lot of pharmaceutical companies and a lot of hospitals are ready to help us and ready to donate drugs for our patients. And up to date, we are working on the least number of drugs we need, because we don't know how many patients go abroad, how many patients stay in Kyiv. In Ukraine. And we are working on the legislative documents that will allow the import of drugs and provide patients with free medicines. And of course, the big problem is possibility of transporting these drugs to the different regions of Ukraine. So we have a lot of tasks in our own country. And in my opinion, the oncological community can help our patients with drugs and with supportive care and with assistance our patients that nowadays abroad.
One other important question to ask is, how are you personally coping under what must be extraordinarily difficult circumstances at the moment?
We have a lot of tasks, and we don't have time for ourselves. We try to do as much as we can, and all of us have families, and we try to support our families too, because in majority cases, our relatives in different regions of our country. So our mornings starts with phone calls for all our relatives, all our friends. But then we start to work, and we begin to work from 6 a.m. and sometimes we finish it after 11 p.m. But we are fine. I think that our situation, oncology situation, is much better than cancer patient situation.
Well, thank you. I know that I would speak on behalf of all of our listeners by just commenting on how much I personally, and I'm sure they would agree with me, number one, the fact that the international oncology community has come to the assistance of cancer patients and cancer healthcare providers in Ukraine. It's good to hear that. And I would also comment, if I may, very humbly on your remarkable dedication to cancer care and to your patients. And we certainly thank you for coming on to the podcast today. We hope that you and your family will stay safe. And please know that you and our other colleagues in Ukraine and their patients and their families are very much on our minds during these difficult days. We hope everyone will be safe. And thanks again for sparing some time to join us today.
Thank you very much.
Thank you. And thank you to our listeners for your time today. If you're enjoying the content on ASCO Daily News Podcast, please take a moment to rate and review us wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.